The National Family Health Survey 2023-24, NFHS 6, the sixth in the NFHS series, provides information on population, health, and nutrition for India and each state, a union territory, UT, except Manipur. As in the earlier rounds, the Ministry of Health and Family Welfare, Government of India, designated the International Institute for Population Sciences, IIPS, Mumbai, as the nodal agency to conduct NFHS 6. NFHS 6, the first in the NFHS series, was conducted by IIPS without any technical or financial support from external organizations. The main objective of each successive round of the NFHS has been to provide high-quality data on health and family welfare and emerging issues in this area. NFHS 6 data will be useful in setting benchmarks and examining the progress the health sector has made over time. Besides providing evidence for the effectiveness of ongoing programs, the data from NFHS 6 help in identifying the need for new programs with an area-specific focus and identifying groups that are most in need of essential services. 4 survey schedules, household, woman's, man's, and biomarker, were canvassed in local languages using computer-assisted personal interviewing, CAPI. In the household schedule, information was collected on all usual members of the household and visitors who stayed in the household the previous night, as well as socioeconomic characteristics of the household, health insurance coverage, land ownership, etc. The woman's schedule covered a wide variety of topics, including the woman's characteristics, marriage, fertility, contraception, children's immunizations and health care, nutrition, reproductive health, sexual behavior, women's empowerment, and domestic violence. The man's schedule covered the man's characteristics, marriage, health issues, nutrition, sexual behavior, and attitudes towards gender roles. The biomarker schedule covered measurements of length, height, and weight for children under age 5 years, measurements of height and weight for women, age 15 to 49 years, and men age 15 to 54 years, and blood pressure and random blood glucose levels for women and men age 15 years and over. In addition, women and men were requested to provide a few additional drops of blood from a finger prick for laboratory testing for HIV, hepatitis B, and hepatitis C. Additionally, dried blood spot, DBS, was collected from children aged 4 to 5 years for hepatitis B testing. Like the previous NFHS surveys, a 2-stage sample design was used to collect data from both urban and rural areas. However, unlike the previous rounds, the Urban Frame Survey, UFS, blocks 2012 to 17 were selected in first stage in urban areas instead of census enumeration blocks, CEB. This strategy improved the identification of boundaries of the primary sampling units, PSUs. Several standard protocols and strategies were adopted to minimize non-sampling errors and maintain data quality, such as multi-level monitoring and supervision of fieldwork, use of computer-assisted personal interviewing, CAPI, for collecting data, centralized training for uniformity in survey implementation, standardized tools and procedures, clinical, anthropometric, and biochemical, CAB, protocols followed as per international standards, secondary editing of data in the field, feedback on data quality to field teams based on real-time data, etc. This fact sheet provides information on key indicators and trends for India. NFHS 6 fieldwork for India was conducted in 2 phases. Phase 1 from 28 May 2023 to 26 February 2024, and Phase 2 from 7 February 2024 to 31 December 2024 by 27 field agencies, FAs, and gathered information from 679,238 households, 716,397 women, and 109,977 men. Thanks for watching Indiavision. Subscribe and be updated.